Who was Harold Shipman? Harold Frederick Shipman, often referred to as Dr. Death, was a British general practitioner and one of the most prolific serial killers in history. Born on January 14th, 1946, in Nottingham, England, Shipman grew up in a working class family. His mother's death from lung cancer when he was 17 is thought to have deeply affected him. She received morphine injections for pain management, a detail that would later influence Shipman's method of killing. Shipman graduated from Leeds School of Medicine in 1970 and began practicing as a doctor. Despite early warnings about his behavior, including a conviction for forging prescriptions for pethidine, a strong painkiller, he continued to work in the medical field. How did Harold Shipman kill his patients? Shipman murdered his patients by administering lethal doses of diamorphine, medical-grade heroin. He primarily targeted elderly women, though his victims ranged in age and gender. Here's how he operated: trust and vulnerability. As a trusted family doctor, Shipman gained the confidence of his patients, many of whom were elderly or in poor health. Administering fatal injections. Under the guise of providing treatment or alleviating pain, he would administer a fatal dose of diamorphine. Forged documentation. Shipman would often forge medical records to indicate that the deaths were due to natural causes or pre-existing conditions. In some cases, he signed death certificates attributing the cause to heart attacks or other ailments. Inheritance manipulation. In at least one case, he altered a patient's will to make himself the sole beneficiary. This aroused suspicion and eventually led to his downfall. How was Shipman caught? Shipman's crimes were discovered in 1998 following the suspicious death of Kathleen Grundy, a wealthy 81-year-old former mayor of Hyde. Grundy's family found it unusual that she had left a significant inheritance to Shipman in her will, while excluding her children. They contacted the authorities, and an investigation began. The police exhumed Grundy's body and found evidence of a lethal dose of diamorphine. Further investigations revealed a pattern of suspicious deaths among Shipman's patients, many of whom had been cremated, complicating evidence collection. Trial and conviction. In 2000, Shipman was convicted of 15 murders and 1 count of forgery. He was sentenced to life imprisonment with a recommendation that he never be released. However, a subsequent inquiry revealed that he might have killed up to 250 people over a 23-year period. Shipman's death on January 13th, 2004, Harold Shipman was found hanging in his prison cell at Wakefield Prison, an apparent suicide. His death deprived many victims' families of the answers they sought. Impact and legacy. The Shipman case had a profound impact on the medical profession and public trust in healthcare. Key changes included tighter regulations. New protocols were introduced for issuing death certificates and monitoring controlled substances. Independent inquiries, greater oversight of doctors, including revalidation of medical licenses. Grief and trauma. The case left a lasting scar on the families of victims and the community. Shipman's actions stand as a chilling reminder of how trust can be manipulated and the devastating consequences of unchecked power.